Hi everyone, my name is Sarah Hartraft and I will be reviewing autism spectrum disorder. According to the National Institute of Mental Health, autism spectrum disorder is defined as a developmental disorder that affects communication and behavior. The reason that autism is considered to be a spectrum disorder is due to the many symptoms that people may experience. The National Institute of Mental Health uses the following criteria from the Diagnostic and Statistical Manual of Mental Disorders DSM-5 to diagnose people with ASD: difficulty with communication and interaction with other people, restricted interests, and repetitive behaviors, and symptoms that hurt the person's ability to function properly in school, work, and other areas of life. The first diagnostic criteria that the DSM-5 looks at is persistent deficits in social communication and social interaction across multiple contexts. This includes, but is not limited to, abnormal social approach and failure of normal back and forth conversation, failure to initiate or respond to social interactions, poorly integrated verbal and nonverbal communication, a total lack of facial expressions and nonverbal communication, difficulties in sharing imaginative play or in making friends and/or an absence of interest in peers. The next diagnostic criteria based on the DSM-5 is restricted repetitive patterns of behavior, interests, or activities as manifested by at least two of the following: stereotyped or repetitive motor movements, use of objects or speech, insistence on sameness, inflexible adherence to routines, ritualized patterns of verbal or nonverbal behavior, highly restricted, fixated interests are abnormal in intensity or focus, hyper or hypo reactivity to sensory input or unusual interest in sensory aspects of the environment. The next criteria is symptoms must be present in the early developmental period, but may not become fully manifest until social demands exceed limited capacities or may be masked by learned strategies later in life. The next criteria is symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. The final criteria of autism spectrum disorder, according to the DSM-5, is these disturbances are not better explained by intellectual disability or global developmental delay. Intellectual disability and autism spectrum disorder frequently co-occur. To make comorbid diagnoses of autism spectrum disorder and intellectual disability, social communication should be below that expected for general development area. Some other important factors to be aware of are the severity is based on social communication impairments and restrictive, repetitive patterns of behavior. Symptoms must be present in the early developmental period, and symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. Looking at Table 2 from the DSM-5, the three levels of severity are Level 1, which is labeled as requiring support. For social communication, this means that without the supports in place, there would be noticeable difficulties in communicating. There would also be noticeable difficulties in switching between activities. Level 2 is labeled as requiring substantial support, and this entails having deficits in verbal and nonverbal communication. There may be limited social interactions and difficulties coping with change without support. Level 3 is labeled as requiring very substantial support. This entails having severe deficits in verbal and nonverbal communication, such as being limited to simple words or phrases. Their inflexibility would interfere with functioning in all spheres. There are environmental factors such as advanced parental age, low birth weight, and fetal exposure to valproate, which may contribute to the diagnosis of autism spectrum disorder. According to the American Psychiatric Association, currently there are 15% of cases with autism spectrum disorder that appear to be associated with a known genetic mutation. Looking at the prevalence of autism spectrum disorder across both U.S. and non-U.S. countries have approached 1% of the population. This is similar across both adults and children that are diagnosed. It is unsure if the higher rates are due to awareness or if there is really an increase in the disorder.